Hi, this is Adam Cooper with Senior Care Savings Group. Today is Friday, March 6, 2015. Today, I wanted to shoot this video for you because there's the very common misconception, and I get a question very, very often, and I wanted to explain to you why it is we have to ask medical questions for a Medicare supplement policy. See, one of the things that I do is I shop the market independently for people to help lower their premium on the exact same plan that they have right now. Meaning if they have a plan F, I go out and find them another plan F just at a lower rate. But when I do that, I have to ask medical questions. So I get stopped in my tracks. Wait a minute, wait, Adam. Why do I have to answer health questions? I thought Obamacare took care of all that. Meaning because of Obamacare, there's no health questions asked, no pre-existing conditions, whole nine yards. And it's a very good question and and a lot of people misunderstand this. So I wanted to answer that for you. So here's the first reason. Well, Obamacare is the Affordable Care Act. Okay. Medicare falls under the Social Security Act. Okay, so they're first of all they're separated. They don't commingle. They don't the rules for Obamacare do not apply to Medicare. Okay, that's one simple way of understanding it. The other thing is Medicare is your primary insurance. You have insurance. It's called Medicare. Okay, and the way you qualify for Medicare is you either turn 65, you are on disability and you have to go through a waiting period, or you have kidney failure. And once you qualify for Medicare, there are no medical questions, period. Okay, so didn't have any medical questions in the first place. Where a Medicare supplement plan comes into play here is it is a secondary insurance. So as we get older, we know that we're going to need more and more medical care, and that medical care can get quite expensive, even though Medicare pays the biggest portion of the cost. Well, the amount that's left over can become very expensive, so a lot of people opt to go purchase a Medicare supplement policy, a secondary insurance to Medicare. And in doing so, when they first turn 65, guess what? You've got tons of all these different insurance companies coming in, bombarding you with mail. You've got insurance agents coming and knocking on your door. You've got insurance agents calling you. And what happens is within when you first turn 65, 3 months before, the month of, and up to 6 months after your Medicare starts, guess what? No medical questions in the first place. You automatically qualify because it's called open enrollment. Now, there's other special circumstances that allow you to get a Medicare supplement policy without any health questions, but that's not what this video is about. I just want to explain to you why that we have to answer or ask medical questions when it comes to a Medicare supplement policy when we're finding you a lower rate. Most of the time, the folks that I'm speaking with have a policy in place already, and I'm just finding them a lower rate. Okay, so they're confused. First 6 months, got on Medicare, didn't have to answer any health questions. I thought Obamacare took care of everything, didn't have to answer any health questions anymore. So again, to answer that question and to hopefully eliminate some of the confusion, two different acts. Medicare is under the Social Security Act, and Medicare is your primary insurance that you did not have to qualify medically for. And the other one was the fact that Obamacare is the Affordable Care Act. Okay, they're all separate. And a supplement plan is a secondary insurance to Medicare that you are not required to get. That's just something that you're choosing to do. Okay, so anyway, I hope that helped out. And if you happen to have a Medicare supplement policy and you'd like to find out if I can find you a lower rate with the exact same benefits, and if you're confused about that, a lot of people say, well, I like the plan that I have, I like the insurance company I'm with, they pay everything. And that's great, and that's absolutely correct. See, in this Medicare New Guidebook for 2014, okay, now there's a 2015 version out. I just haven't updated mine yet, but it's all the same. On page 68 of 2014, on page 92 of the 2015 book, it says, and it's exactly the same. There's no difference. They just put it on a different page for whatever reason, but it says Medigap policies are standardized. Okay, so that's the first thing. Every Medigap policy must follow federal and state laws designed to protect you. Period. They all have to follow the same rules. Okay. The other thing is it says different insurance companies may charge different premiums for the same exact policy. And these are the standard policies right here. They're all standardized. If you can see that there, let me get that a little closer. Okay, so those are the standardized policies. So that means a plan F is a plan F is a plan F no matter what company you get it with. It just basically depends on the price that you pay. And that is not standardized by the government. Okay, different insurance companies can charge different premiums. What I do is help you find the lowest price plan possible or same plan. If you want a plan F, let me know. I can try to find you a plan F from another company, just at a lower rate. That's it. That's simple. Just give me a call, 870-215-3136. Again, it's 870-215-3136. I appreciate your time. Make it a great day. Have a good weekend, and we'll see you next time.